We're joined today by members of our administration as well as medical professionals who played integral roles in the design and development of the guidelines for schools to safely reopen in the fall. In developing the back-to-school plans, the department and our administration considered not only the risks associated with COVID-19 for in-person schooling, but also the risks associated with continuing to keep students out of the classroom. Continued isolation poses very real risks to our kids' mental and physical health and to their educational development. This plan will allow schools to responsibly do what is best for students, which is to bring them back to school to learn and grow. The detailed document released today was developed with extensive conversations with medical experts, school administrators, and other education stakeholders. Commissioner Jeff Riley and his team worked with infectious disease physicians, pediatricians, and the COVID-19 Command Center's Medical Advisory Board to develop these plans. And thanks to that work, the Massachusetts chapter of the American Academy of Pediatrics supports this carefully developed guidance to bring kids back this fall. School officials now have a blueprint that they can use to create plans using 3 models of learning with a priority on providing in-person instruction. Again, the goal is to get kids back to the classroom, but we're advising districts to develop additional plans. These plans could be implemented if COVID-19 conditions change and districts need to adjust their programs. Commissioner Riley will discuss the 3 plans' details shortly. Over the past several weeks, Massachusetts has seen rates of infection, hospitalizations, and fatalities fall steadily, even as the virus remains a significant concern. As we all know, COVID-19 in Massachusetts is not static, and we'll continue to monitor the situation closely to make any adjustments that we need to make. Part of the challenge in developing this guidance is that we're talking about a school year that starts a few months from now, and sometimes it's difficult to forecast where exactly we'll be when we get to September. This guidance assumes that health data continues to stabilize and the requirements are still subject to revision. But now districts can get to work on their preparations to be ready for the fall. We also understand that there are costs associated with implementing many of these recommendations, and that's why we're making available approximately $200 million in additional funding for district school costs related to reopening. This comes on top of the nearly $502 million that our administration made available to cities and towns to spend on COVID-related costs at the end of last month. Massachusetts cities and towns also received almost $200 million in federal elementary and secondary school emergency relief fund grants earlier this year. And additionally, in partnership with legislative leadership, our administration is committing $25 million in federal funds to a matching grant program to fund technology purchases for remote learning should it become necessary for school districts. With DESE's guidance and financial support worth just about $1 billion, school officials have the information and the resources that they'll need to implement the needed distance requirements, classroom configurations, mask and face covering requirements, and symptom checks to make this all happen. Parents and guardians have done their part, stepping up in extraordinary ways virtually overnight to become educators at during an enormously challenging time. Now we have an obligation to do everything that we can to get kids safely back into the classroom so that they can benefit from the guidance and the experience of their teachers, other leaders, and their peers. To sum it up, we really appreciate the work that so many people put in to helping us develop a plan to help kids safely return to the classroom in September. Secondly, this plan was developed with the support and assistance of many members of the infectious disease, healthcare, and physician community, and we're really pleased that the Mass chapter of the American Academy of Pediatrics endorsed it. And third, there's almost $1 billion in state and federal funding that's available to make sure that our districts have the resources that they need to implement this plan.